I think I accepted the offer to work as the nurse clinician, or nurse navigator now, at WVU Medicine because I wanted to be a part of something bigger. I wanted to be invested in this program, and I feel like I've done that, with my blood, sweat, and tears. I think the most rewarding thing for me as a nurse navigator for our joint replacement patients is seeing these patients be in so much pain prior to their surgery, and then getting to see them before, during, and after, and see what we do to change their lives. I think that my superpower in working with these patients is I have made myself available to them and made them feel like they're not going to call our office and just get a recording. Somebody is going to get back to them, and keeping that personal touch with each and every single one of our patients. And where I feel that I absolutely love my job is when we're able to do Operation Walk. It is a program that is nationwide that helps people who are unable to afford getting joint replacements, whether they don't have insurance or maybe from financial inabilities. What do I like to do when I'm not at work? Well, being the mom of boys, I have 4 boys, and I have 2 that played football at WVU, and we've always gone since they were little to WVU games, been involved in WVU sports. Now it's kind of shifted a little bit in the fact that we have 2 granddaughters and a new grandson. We have focused a little bit more on the grandchildren. A lot of people would be surprised that I'm actually a breast cancer survivor. I had breast cancer 25 or so years ago, and going through that while working in a busy neurosurgery office, and the support I had, and knowing what it means to be the patient, I think is some of what drives me as well, that I don't like our patients waiting for results or waiting for an answer back from me, because I know what it's like to be on the other side of that. I think I have a passion for this patient population, and knowing how what we do will impact them for the rest of their lives. This type of patient, this surgery is life-changing for them. And being part of that, I think, is what keeps me here.